I think if there's one process or one disease entity that's diet and lifestyle dependent, it's diabetes. We can't even begin to talk about drugs until a patient understands how to eat and the importance of exercise. And one of the things we do when we first get started with a patient is teach them that exercise works very much like the medications that they're taking, and far better for all of us not to have to take a lot of medications. And oftentimes what we'll do is send them home and we'll say, check your blood sugar before you exercise and immediately after exercising. And they'll come back in and tell us amazing stories. And that is a motivating factor for exercise. The diet is very hard to understand for most people. Labels are hard to read. There's so much information that patients with hypertension, dyslipidemia, or hyperlipidemia, and diabetes have to worry about, that by the time they're done, they have no idea what to do because the foods that are low in carbs are often high in fat, just to help them taste good. Or if they're not high in fat, they're high in sodium, and they can't do that because of their high blood pressure. So it's very complicated, and we really try to simplify it. Dietary instruction has changed a great deal in the last 5 years. What we tell people, you can eat what you want, you just got to understand how to balance your foods in such a way that you don't eat too many carbs, you don't have too much fat, but we really try to simplify it up front with the diabetics because it takes an enormous amount of time and energy and knowledge to really begin to learn how to eat. And that's something that's very difficult in the primary care practice to teach.